Looking for solutions to manage hyperglycemia?
Do you want to know the secrets of the most common medications used for diabetes?
We're Colin.
Hillary.
And Alexandria.
We're here to break down the 4 key players in diabetes management: biguanides, sulfonylureas, glitazone, and alpha glucosidase inhibitors, or AGIs.
Okay. First, the biguanides, like metformin. They lower blood glucose by inhibiting liver glucose production and increasing insulin. It is typically the first-line medication in adults with type 2 diabetes, and it's taken orally. Instruct the patients not to drink alcohol while taking this drug to reduce the risk for lactic acidosis. This drug must be stopped before certain imaging tests that uses contrast agents because of the increase for kidney damage and lactic acidosis.
Next are sulfonylureas, which are insulin stimulators. They lower blood glucose levels by triggering the release of preformed insulin from beta cells. Instruct patients to take these drugs with or just before meals to prevent hypoglycemia. Patients must check with their provider before taking any over-the-counter drugs or supplements because these drugs interact with many other drugs. Can you hear me? Hello? Are you still there, Miss Johnson? Do y'all know Rapid's number?
Third, the glitazones, or TZDs, which are insulin synthesizers. They lower blood glucose by decreasing liver glucose production and improving sensitivity of insulin receptors. Teach patients to report a weight gain of more than 2 pounds in a day or 4 pounds in a week to the prescriber. This is because these drugs increase the risk for heart failure. Can I get a crash cart?
Finally, AGIs like acarbose and miglatol. These work by having an action in the intestinal tract. Teach patients to take these drugs only with a meal and warn patients that abdominal discomfort, bloating, flatulence, nausea, diarrhea, and indigestion are all common side effects.
Ventilate.
So there you have it, 4 powerful ways to manage diabetes.
And remember, the key teaching points: lactic acidosis risk with biguanides, hypoglycemia with sulfonylureas, and heart failure risk with glycetones.
The information for this presentation was sourced directly from our medical surgical nursing ebook as required. And now for your NCLEX moment. A nurse is providing discharge teaching to a client prescribed metformin for type 2 diabetes. Which instruction should the nurse include? A, you should stop this med if you develop diarrhea. B, take this med on an empty stomach for best absorption. C, avoid alcohol while taking this med. D, it's normal to feel sleepy after taking. The answer is C, avoid alcohol while taking this med.
The nurse is preparing to administer pioglitazone to a patient with type 2 diabetes. Which assessment finding is the most critical to report immediately to the provider? A, abdominal discomfort after lunch. B, a blood glucose of 145. C, gained 3 pounds in 2 days. Or D, patient reports taking an over-the-counter multivitamin. The answer is C, gained 3 pounds in 2 days.